I'm Jenny Middleton and I'm the editor of Nursing Times. Nursing Times is running the Speak Out Safely campaign, which aims to ensure that the NHS is a safer place for all staff to raise concerns about patient safety. Since we launched this campaign earlier this year, we've been contacted by a number of staff across the NHS, nurses, healthcare support workers, doctors, consultants, who've all come to us and told us about their experiences of raising concerns. Some of them have been really good, but some of them have been less so. We need to ensure that consistently across the NHS, when staff have concerns, they are listened to and well supported. And that's what this campaign aims to do. We want to ensure that there is an individual duty of candour introduced, as Robert Francis recommended in his report. And we also want the government to review the Public Interest Disclosure Act to ensure that whistleblowers are protected. And we want to make sure that all NHS employers have a fully accessible and well-documented raising concerns policy, so that when staff do feel they have to raise a concern, they know how to do it and they are well supported and protected when they do. The only way to make the NHS a safer place for patients is to ensure that we listen to and really listen to and support those staff who are telling us what's happening to patient care. That's not always being the case, and here are just some of the people's stories that we spoke to when we asked them what had happened when they blew the whistle.
I'm Helene Donnelley and I was an A&E nurse at Mid Staffordshire Foundation Trust Hospital, and I'm now a nurse practitioner working for the Staffordshire and Stoke-on-Trent Partnership Trust. I was concerned because patients were treated in such an appalling way. They were not prioritised, the targets were put before them and their care. Patients were seen as an inconvenience by staff. Staff were routinely being bullied by other colleagues, and pressure was placed upon them to lie and falsify the breach times in A&E.
My name's Kim Holt and I'm a consultant paediatrician working in Haringey as a designated doctor for children in care. I'm employed by Whittington Health. Previously, I worked in the same job, but I was employed by Great Ormond Street Hospital. When I was working for Great Ormond Street in the post in Haringey, myself and 3 other colleagues, we were concerned about admin issues, around staffing issues, and around problems with communication within the team. The things that we saw impacted upon patient care in that children were not being given appointments in a timely way. There sometimes were long delays for children in being seen. We didn't have enough doctors really to cover the workload safely. In fact, at the time, there were 3 or 4 consultant paediatricians, and following the death of baby P, it was recommended that we needed 9 paediatricians. So we were significantly understaffed, which meant that there were long delays. We couldn't attend meetings, we couldn't do visits with social workers, and that would all increase the risk with regard to child protection.
My name's David Drew and I was a consultant paediatrician at the Manor Hospital in Walsall. I initially raised concerns about the competence of one of the consultant staff that I was managing, and that resulted in me being removed as clinical director in that department. Subsequently, I raised concerns about child protection. There was a child that died after what the trust admitted were catastrophic mistakes on its part, and resulted in the avoidable homicide of that child. And then the trust refused actually to remedy the mistakes that had been made. So there was that. Then there were problems with unsafe environment on the ward during the winter time. We're in an old Victorian building. The heating was breaking down repeatedly. Babies were getting cold. Fortunately, there were no serious casualties, but if we'd have had ill babies in the ward at that time, then we definitely would have had casualties from that. There was a big nursing redundancy program which was handled very, very badly. They were trying to make doctors in the department redundant, And this was all to cut costs, of course, for the new hospital that was being built and for foundation trust status. So the whole of that was managed by a group of managers who were brought in, who had no paediatric qualification and who had no experience in paediatrics, and who were later judged by a Royal College review as managerially aggressive and failing to engage with frontline clinical staff.
I'm supporting the Nursing Times Speak Out Safely campaign because I think it's vital that there are changes made to support whistleblowers when they do speak out, and also encouragement and raising awareness of the importance of people speaking out and raising concerns when they see them.
I support Nursing Times Speak Out Safely campaign because my belief is that we need to empower the frontline to give them confidence in terms of how to raise concerns and how to make sure that we don't have the sorts of appalling care that have documented that happened in mid-staffs. I don't think any nurse would want to work in such an environment. So we want to help, we want to help nurses to feel confident to speak up, and I think the campaign is really going to sort of raise awareness and about how they safely can do that.
I'm supporting Nursing Times Speak Out Safely campaign because that's a natural continuation of my whole professional life. I've always valued and supported nurses. As a paediatrician, you can't do your job without nurses. And I do think that nurses are particularly vulnerable to bullying and to pressure in the workplace. So they're a very, very, very big group, and if there's going to be a culture change in the NHS, it's probably a good idea to start with such a big group who are in the firing line to start with.
I hope that you found those stories informative and that they've made you realise just how important it is to listen to the staff who are raising concerns. If you want to find out more information about Speak Out Safely, then please do go to nursingtimes.net/SOS and sign our petition. Thank you for watching.